Hello. So today I'm going to talk about the Mayo Radiology project. That's a tentative name, and essentially it's about fall prevention for patients at the Mayo Clinic. So who is our community partner? Our community partner is the Mayo Clinic Phoenix more broadly. They are a local nonprofit hospital. They have 268 licensed beds and 28 operating rooms, as well as an emergency department with many patients and also many physicians, so it's quite a busy place, but very invested in high quality care. Key stakeholders are Dr. Flug, who reached out to us for this project. He is very interested in improving the quality of these x-rays. And there's also Howard Osborne and Lisa Ponce. Howard provides perspective on how nurses view this issue, and he's also very invested in falls prevention. And Lisa has intimate knowledge of the actual process that we're dealing with here and how complicated it is to improve the quality of an x-ray based on the limitations they have from an imaging perspective. So what is the actual problem here? The problem, simply put, is that hospitalized patients in need of chest x-rays at the Mayo Clinic Phoenix are falling and injuring themselves. So here is kind of a simple view of an x-ray setup. You have the generator, the object itself, so the person, and then an x-ray detector. And it looks a little bit different at the Mayo Clinic, but it's the same setup. So the basic need here is imaging equipment, aka a chair of some sort that we would assist in imaging purposes. So if the patient needs a chest x-ray and it's unclear because they're coming from the emergency department how sick they are, we want to reduce the possibility that they could fall and injure themselves. In a normal chest x-ray, you would be standing ideally so that you could be flush against that detector that you can see here. And for various reasons, the wheelchair itself is in the way. And the Mayo Clinic has been experiencing 2 to 3 falls per cord with injury, $10,000 approximately each. It's very expensive, and it's not good for patients. So ideally, patients would be able to sit. What they would do is they would be facing the detector that you can see here in the top, and they would wrap their arms around it, and then they could be imaged that way. But the wheelchair, as it's designed, prevents you from being flush against that detector there because the arms are in the way, and then also when you're actually facing it, the arms are also in the way. And from various imaging views, the metal is not radiolucent, so it shows up in the x-ray, and they don't want low quality x-rays. Here's more views of the problem. You can see him, Dr. Flug, with his arms wrapped around the detector. So we have to also consider that the radiology department serves all of the patients in the hospital, so they're seeing a multitude of different types, and it's challenging. So what solutions do we have? If patients stand, we're risking falls. If they lay down, the problem is that there's a poor quality x-ray. So the chair needs to be radiolucent. It should be a strong material. The patient needs to be sitting upright. It needs to be mobile, serve the function of a regular wheelchair, etc., etc. Solutions we thought about were carbon fiber or PVC, and then adjustable wheelchair arms or handles. And the wheels, the big wheel is also in the way, so ideally smaller wheels. So we thought about a couple of different options. The adjustable handles are not so much a concern anymore, as we realize that having the handles out of the way is really not as important. Here are some designs that we had concept-wise at the very beginning. We've sort of abandoned most of these because we've gotten a little more complex. Here was a design to adjust the handles, but now we don't think that that is as much of a concern. So for prototyping, we took a chair and sawed off the arms, replaced them with PVC. We added the adjustable handles, and We also recently tested radiolucency of some materials because that was a real question for us. And we went to the Mayo Clinic, and here are the x-ray results. Some of them you can see on the right when they're imaging laterally, so from the side, the wheelchair itself shows up completely in the x-ray. And then on the left, you can see also that here's a carbon fiber plate, and you can it's pretty much radiolucent. You can kind of see the line on the right where there's a density shift, but it may not be that big of a deal if the whole area is covered in that same density. And then here's PVC. Unfortunately, we determined the PVC does show up. You can see that it looks exactly like bone. Not ideal. So our next steps, to assemble more prototypes, we would like to test a couple more materials for radiolucency, design a new arm concept, fix a couple of the issues, and find manufacturers to potentially create a carbon fiber wheelchair. And this will have significant impact in the hospital, preventing falls, easing the burden on techs, and just overall improving the quality of chest x-rays and comfort for patients. And that's it.